Welcome everyone to the Kneel Foot and Ankle, the Fly Foot Doctor. Here we're just showing another case of fungus toenails and trimming it as much as we can. As you can see here, if you look at this patient's skin, it's dry. The skin texture and turgor is pretty poor. The skin is not supple. The nails are also pretty dry and brittle. They're shedding and they're flaking, and barely touching them, they are crumbling. A lot of the times what could be going on here is a mixture of a fungus infection that has infected the toenails, as well as a complication from peripheral arterial disease. When patients have peripheral arterial disease, what happens is they do not have adequate blood flow to their extremities and to other parts of the body as well. Now, the extremities suffer a lot more because they are typically in a dependent position. And at this time, we're talking about the lower extremities. They have gravity working against them. And with lack of blood flow, they don't have enough nutrients in the blood to nourish the several aspects of the body and the skin, particularly here, the toenails. And so there are times where you would see a patient with thickened, elongated, brittle toenails, and you would suspect for sure 100% it's caused by fungus. But sometimes in the presence of peripheral arterial disease, you can definitely see the toenails present as such. And so we definitely urge these patients to be taken care of by a specialist to make sure that their toenails are being trimmed regularly and that they are not doing it themselves, because they could easily cause damage to the toenail bed, and they could also cause injury to themselves. And this would be very difficult to heal because, again, we've talked about the lack of blood flow to bring all the nutrients and all the healing factors to the area of the wound. And so it is imperative that patients with peripheral arterial disease be taken care of. Now, how would you know if you had this? If you look on this foot, you see the second toe particularly has this purple hue to it. In that situation, you know that this person definitely has vascular issues going on. In the absence of severe swelling, pitting edema, and in the presence of non-palpable pulses, delayed capillary refill time. And what that means is if you press on the tip of your toe for about 2 seconds and the color does not return quickly, then you know you have delayed capillary refill. And that is a sign that you may be having peripheral arterial disease. You see, like we talked, the purple hue, the shiny skin on the lower extremity, the lack of hair growth in the lower extremity or in the areas that may be affected, the thin, brittle, dry, crumbly nails in the affected limb. Those are all signs of fungus. Excuse me. Those are all signs of peripheral arterial disease. And yes, a lot of times you would have fungus toenail infection that does overlap with peripheral arterial disease. Now, when we have this, how do we take care of it? Well, like I stated earlier, you go see a foot specialist. They take care of your toenails. As far as the blood flow, things like an arterial brachial index, which is called an ABI, will be obtained to sort of get a baseline evaluation of the quality of blood flow going to your limbs. Subsequently, a patient will be referred to the vascular specialist, which is a blood flow specialist, and they do a whole workup. They look at the lower extremity, the upper extremity, the heart, the arteries, the big arteries around the body, to make sure that there are no clots or anything like that. I know one of the big ones they look at for sure. They look at the ones going to the heart as well as the ones going to the brain, because what you would hate to have is a heart attack or a stroke due to lack of blood flow, maybe because the arteries are clogged or they're narrowed, in which they call stenosis, or whatever else you may have. So, yes, toenails, as much as they look like fungus, and sometimes they are fungus, they could be a good indicator of other things that could be going on in the body. So the next time you may be concerned or have questions about your foot or your ankle, be sure to reach out to your local podiatrist. Please leave your comments, questions, and any kind of comment you may have, leave it in the comment section below. Please subscribe. Please share this video and enjoy watching the rest of the show. Thank you.